Welcome back to Torn. If you're new to the channel, I'm Dr. Mark Wygand. I'm a board-certified sports physical therapist, and the goal of Torn is to help educate on and simplify the ACL injury. So in this series, the last couple of videos, we've broken down what the ACL is, how it's torn, and the next logical question going forward is, who is actually at risk for ACL injury? So let's dive into it. Before we get started, I want to make the distinction of what a risk factor actually means. So just because you may fall along one of these risk factors that I speak about does not guarantee that you're going to go out and tear your ACL. A risk factor just means that there's a higher association for an ACL injury compared to someone without that factor. In this video, we're going to break down ACL risk factors into a few different categories: anatomical, neuromuscular, sex-specific factors, genetic factors, a previous history of ACL injury, and the last one being sport-specific or environmental factors. So let's start with anatomy. There are certain anatomical differences amongst athletes that may predispose them or increase the risk factor for ACL injury due to largely things that we cannot change, right? So anatomical differences just means the way that your body is built, and some people have different anatomical changes that may predispose them to injury versus others. So one of the most discussed anatomical differences that we see in the literature is the intercondylar notch. The intercondylar notch is essentially the notch or tunnel in which the ACL sits inside the joint. In some athletes, that notch can actually be a little bit more narrow or smaller. When the notch is smaller, the ACL has less room during high-speed movements like cutting, pivoting, or landing, and that movement causes a little bit of a stress on the ACL, and in some cases may even contribute to the ligament being rubbed on or impinged during these extreme knee positions. The next factor we have anatomically is the tibial slope. So I'm going to use an image to help describe this because this can be a little bit confusing at times. So naturally, everyone has a tibia that sits a little bit more horizontally, as you can see kind of in that normal image, versus the other image you see a slight tibial slope, and what we call this is a posterior tibial slope. So the ACL's job is to prevent the shin from going forward. So when the slope is steeper, the ACL actually experiences greater strain, especially during deceleration, cutting, and landing events. So the last anatomical difference that we'll talk about is generalized joint laxity. So what does laxity mean? Essentially, laxity is talking about the ligament itself. So when we talk about someone who is hypermobile or has a lot of movement within the joint, that may predispose or increase the risk factor for ACL injury. So the next factor we want to talk about is neuromuscular control. What does that mean? Essentially, neuromuscular control is the way in which the body moves. So it's the way in which the brain and the muscles coordinate movements, which may predispose that ACL to a higher risk of injury. So when I educate and teach on neuromuscular risk factors for ACL injury, videos can help substantially. So we'll break down some of these different risk factors from a neuromuscular control standpoint with videos and pictures. So the first one is when an athlete lands with excessive knee valgus or when the knee falls in. The second one we're going to look at is poor trunk control. So in this video, you're going to see that the athlete is cutting left to right. As that athlete loads to that left side, you can see that the trunk is actually flexing or leaning to that left. Next one we have is delayed or inefficient muscle activation. What does that mean? As that athlete lands, you see a very stiff knee. So what I mean by that is as they're not landing very softly. What we call that is a quad dominant athlete. So when an athlete lands a little bit more stiff, they're not using the appropriate musculature to have a soft landing that helps decrease the strain on the knee. So the next risk factor that we're going to talk about is sex-specific or hormonal factors. So in the research, and this is a very consistent finding that we see, is females have a higher tear rate than males. And in the research, we see that actually it's a 2 to 8 times higher likelihood in the female population than the male population. What is this due to? Well, there's a number of factors. Anatomically, we see that females have a wider pelvis than males. Secondarily to that, anatomically, we see that the female actually has a slightly more narrow intercondylar notch that we discussed earlier. Other factors that we see are hormonal changes that we're starting to see in the research, that because estrogen and some of these other hormones play a factor in that may actually increase the laxity within the ACL, which predisposes to ACL injury. Other factors that we see can be more neuromuscular risk factors. So females tend to land with a little bit more valgus. They talk about quad dominance that we just discussed. Females tend to land with a little bit more of a stiff knee. So the muscular differences or the ratios in which we land are slightly off as well. If you want a more in-depth description of these different factors of why a female tears more than a male, click that link above. So next one, genetics. We're starting to see emerging in the research that there is a genetic or familial component to ACL injury risk. So family history of ACL injuries may predispose or increase that risk of ACLs for that athlete. When I see my athletes, a lot of times I'll ask if the mom or dad or, a brother or sister have torn their ACL. And a lot of times I will actually hear them say, oh yeah, my dad did back in high school. So what we see in the research is that there's up to potentially a 70% contribution to an ACL injury risk coming from genetics or familiar history. So the next one is simple. One of the strongest and most consistent risk factors for an ACL injury is a prior history of injury. So someone who has had an ACL reconstruction in the past, in the research, they are 20 to 30% more likely to tear or re-tear an ACL in the future. And what this does, it exposes why the rehab setting and the return to sports setting is so important and so critical. So the last risk factor that we have is the specific sport or the environment in which the athlete's playing. So the one factor in this category that I want to speak on that has the highest level of evidence is an athlete that is talking about returning to a level 1 sport, which involves high levels of cutting, jumping, landing, contact, like basketball, soccer, football. Some other risk factors when we're talking about sport or in the environment in which they play, there's not a ton of research out there to support some of these things, but we are looking further into it, such as turf versus natural grass, and we're starting to see some papers come out, and the NFL is looking into that a little bit more. We see, some factors look at whether fatigue plays a role. We're starting to see maybe footwear might play a role, and even weather changes. So more evidence needs to be supported in some of these different areas when we're looking at sports or environment, but there is an association, or we can look into this further because there's been talk about it. So what are the big takeaways from this video? Well, first and foremost, ACL injuries are multifactorial. I'm not just going to pick one of these risk factors throughout this list that I just discussed and say that's the reason why I tore. It's a combination of risk factors that kind of culminates into the perfect storm of why an ACL injury occurs. The other thing that I want to highlight is the difference between modifiable and non-modifiable risk factors. Non-modifiable risk factors are obviously the ones that we can't change. So we can't change our anatomy. I can't change my genetics. I can't change my sex from being male versus female. But what I do want to highlight is the modifiable risk factors. So these are the changes that we can make that can actually reduce those tear rates, right? So when we look at neuromuscular changes, when we look at strength, how the body moves, how we land, how we cut, we can actually affect these changes quite substantially. So I want to make that clear that just because you have one of these risk factors does not mean that you can't change it, because a lot of this you can supplement with strength or movement patterns or cues to reduce your risk rate. Thanks for watching. In the next video, we'll take everything we've just discussed and go into a little bit more depth and detail of how we can reduce those risk factors. If you found this video helpful, subscribe to the channel, comment below, and share with anyone who may be going through ACL rehab right now.